The government's chief medical officer has warned that long COVID is likely to soar amongst younger people in England when the coronavirus restrictions are lifted. Chris Whitty said that while he expected deaths to be much lower in number than previous waves, long COVID would remain a worry in ages where the vaccination rates are currently lower. So should this be factored into the government's plan for easing? And what could it mean for the health and happiness of our young? Nick Watt reports.
The long tail of a virus still devastating lives and whose shadow will haunt us for decades. A fit, young, energetic student leader in the prime of her life, now laid low by long COVID.
As soon as I got sick, I had to go on full-time sick leave. I haven't been able to work since then. I played football 3 times a week. There's no way. I can't walk for longer than 10 minutes. There's no way I can play football. And yeah, I would say I lived quite a hedonistic lifestyle, which I can't do. I wouldn't want to at the minute anyway, just because of how things are with the virus, but also because I don't know how it would interact with my body if I got infected again. It could kill me.
And now, as England prepares to open up, a warning that many more will suffer from long COVID.
There's a lot of COVID at the moment and the rates are going up. I regret to say, I think that we will get a significant amount more long COVID, particularly in the younger ages where the vaccination rates are currently much lower.
The government estimates that we could have as many as 100,000 new cases of COVID a day by August. And data suggests that almost 400,000 people in the UK have reported having symptoms of long COVID for at least a year after their initial infection. The vaccines will offer some help with the condition.
What does the Prime Minister...
Keir Starmer highlighted the threat of long COVID as he accused the Prime Minister of opening up too quickly.
Mr. Speaker, let's be clear why infection rates are so high. Because the Prime Minister let the Delta, or we can call it the Johnson variant, into the country. And let's be clear why the number of cases will surge so quickly, because he is taking all protections off in one go. That is reckless.
Mr. Speaker, I really think we need to hear from what the Honourable Gentleman what he actually supports. We will continue with a balanced and reasonable approach, and I've given the reasons. This country has rolled out the fastest vaccination programme anywhere in Europe. The vaccines provide more than 90% protection against hospitalisation, both of them, Mr. Speaker. By the 19th of July, we will have vaccinated, every adult will have been offered one vaccination.
A key moment beckons and hostilities have resumed. On the Conservative benches, there's strong support for Boris Johnson amongst the outspoken lockdown sceptics. Elsewhere, there are some nerves. One Conservative MP who's been on the cautious side said they were surprised at the planned lifting of the legal requirement to wear a face covering. And a lockdown rebel, well, they also raised an eyebrow on masks and wondered whether the country was ready for such a full-scale scaling back of the restrictions. A global health expert has concerns about the pace of the opening.
I just think, at a time when we've got this exponential growth happening, right, 100,000 cases a day is going to be millions of cases over the summer. And at this time, this isn't the time to then be abandoning everything. Now, I understand that the vaccination programme is working and it is having an effect on hospitalisations and death. But that is not zero. And only half the population are currently fully vaccinated.
A mood of reflection as England prepares for its biggest step back towards our old life, but uncertainty and jeopardy hang in the air.
Nick Watt there. Well, joining us now, Mark Walport, SAGE member and former Chief Scientific Advisor, and Ondine Sherwood, the co-founder of Long Covid SOS. Mark, if I can come to you, the focus has been very much on this link between cases or rising case numbers and hospitalisation. I wonder where you think that leaves the calculation about long COVID, which is hardly ever mentioned.
Well, we should never forget that actually many people, even if they don't end up in hospital, have quite a nasty infection, and a fraction of them, maybe between 5 and 10%, which is a lot of people, are going to end up with prolonged symptoms. And there's a lot we don't know about long COVID, and it probably represents 3 or 4 different things. But there's no question an apparently mild infection at the time can leave people with quite profound and prolonged disability.
So you might not know. You might have a very mild bout of COVID, but still be prone
still
to
end
long
up
COVID.
with prolonged, particularly fatigue and malaise. And of course, what we're seeing at the moment is we've got about 27,000 cases on average a day, a doubling time of between 1 week and 2 weeks, and that's on the current level of social restrictions. So if we take the brakes off completely, then that rate the doubling time may go up even more. And so the Prime Minister did say we mustn't throw caution to the wind, and we really mustn't.
Undine, can you talk us through the kind of people that you're seeing and you're helping? Because I think sometimes there's a sort of preconception or misconception that long COVID is just a sort of a long bout of fatigue post-illness, and that's not what you're seeing, is it?
No, not at all. And I think there is a problem because it tends to be associated with post-viral fatigue, and it's a lot more than fatigue. Remember that COVID-19 is a whole body disease, and therefore long COVID, it manifests itself all over the body. Of course, yes, fatigue is a common problem. Shortness of breath, muscle pain and cognitive problems are the 4 top symptoms in adults. And those symptoms can really make it very difficult to get through a normal day. There, as you heard in your interview just before, that young woman can't walk. She can't walk very far. She can't exercise. People's lives have been radically changed, and they just cannot get back to where they were before.
And are you seeing younger people present with this, or even children with long COVID signs?
Absolutely. I mean, it shocked me when I first joined the support group that I belonged to, how many young people were there complaining of symptoms which were frightening. Young people talking about problems with their hearts, talking about neurological problems, and you can imagine what an impact that has on a young, healthy and often fit person. It struck me that a lot of people were extremely fit before they caught COVID and then ended up with long COVID. And yes, it does impact on children as well. And the ONS figures demonstrate that there is a sizable proportion of children who have COVID and then don't get better.
Mark, I wonder what that does to social policy. I mean, if we think we're going into a period of summer where it's the young predominantly who won't be vaccinated, who are more at risk of catching COVID, who could then be seriously affected for long periods of their time.
Well, of course, our long-term defence against this is vaccination. And so the critical thing is to absolutely get on with the vaccination programme, vaccinate all age groups, and I think that JCVI are going to have to look very carefully at the question of vaccinating teenagers in particular, because it's vaccines ultimately that are going to be our defence against this. But obviously, if the numbers go up in an uncontrolled way, then there are the risks of everything from those very severe complications, and we are seeing more people in hospitals. It's absolutely true that the link with death has been very strongly weakened, though not severed. But if we have huge numbers, then there will be people who've had milder disease who will nevertheless end up with long-term complications. Well, and as I say, it's not one single thing. It almost certainly is a variety of different syndromes. And undoubtedly people who actually ended up in hospital, many of them have quite persistent organ damage, particularly to their lungs.
Would you be advocating children's vaccinations, Undine? I mean, is there an age at which you wouldn't vaccinate?
Well, I'm not a scientist, I'm not a doctor. But other countries are vaccinating children, and certainly I don't see any reason why teenagers shouldn't be vaccinated. There are other mitigations that can be put in place in schools, for instance, to make schools safer. That hasn't been done, such as ventilation. And of course, the idea of removing all mitigating factors it makes no sense. And in fact, mask wearing was not mandated in school quite a while back, and the infection rates in schools have been enormous. So something has to be done to protect the children and the adults, the unvaccinated adults. And can I just make another point? And that is that we know that even people with 2 doses can get mild disease and are getting mild disease. And unfortunately, we do not yet have enough data to say for sure that the rates of long COVID are reduced in people who had 2 vaccinations.
Mark, on the question of vaccination, the rate has slowed down noticeably in recent weeks, which perhaps hasn't been explored or talked about as much as it could have been. We used to be one of the fastest nations at the beginning, and I think our rate is now fallen.
Other nations are catching up,
They're
although we
catching-
are well ahead of most countries. But I mean, in a sense, the race is not with other countries, it's to get as many people vaccinated as we possibly can.
So why has that slowed now? Is it because more people are isolating? Is it to do with...
I
mean, do you think
I
we
really
just
know
hit
the
on
answer.
peak?
I mean, some of it may be supplies, but I think it's obviously once the easy people to get to, there are people get slightly harder to get to, but I mean, there is very good uptake amongst younger generations. We're seeing when there are these one-off occasions that people can turn up, lots of people are turning up. So it is actually vital, and actually by delaying the easing of restrictions by about a month, about another 4 million doses have been given. So I mean, there's lots of vaccine going in. It was worth doing.
Okay. Thank you both very much. Thank you. Now, Hungary.